today. Have you ever been told by a doctor or had someone suggest to you or a loved one that if they simply lost weight, if they simply weighed less, is that going to make all of my knee pain go away? We're going to dive in and talk about that today. I am Dr. Shari Miller, orthopedic physical therapist, owner and founder of Athletic, and a bunch of self-help programs. I am so happy to be here today and to fill you in on this question that drives me bonkers. Don't know about you, but it definitely does to me. Let's dive in. So, does weight make a difference with your knee joint? There's a few arguments that can be made on this. So technically, when you are running, for example, your body has about 5.5 times your body weight of a load going on one limb. That's why sometimes running bothers us if all of a sudden we've had a weight gain. Now, if it's been a sudden weight gain that's unexplained, definitely see your doctor. That's something you want to have assessed to rule out anything crazy going on for just general knowledge. But if it's like, oh my gosh, the last year has been insane, just gained some weight and now like my knee hurts. What is that? And like, is it gonna get better? Honestly, the difference is not so much your weight as much as it is your muscle strength and what the symmetry of your body is. So often our body is out of symmetry. We have one side that's doing so much work and then one side that's not carrying its load. When one side doesn't carry its load, the other side overworks. And that's why you might notice like, oh, this knee hurts. But all of a sudden this hip is starting to drive me nuts. What's going on? Honestly, it's related, and it's a difference of what muscle groups and what areas are doing their job and who isn't doing their job. So sure, if you want to talk about like forces on the body, when you take it as a math equation and you add a higher weight compared to someone that's a lesser weight, and you're looking at purely a math equation, sure, there are less forces on the knee when you weigh less. That's simple biomechanics, which is looking at joint angles and forces and putting physics to the body, essentially. That's what the study of biomechanics is, and that's part of what physical therapists study in depth and in detail. However, is the answer just to lose weight? No. And that's the struggle. So the struggle is, how on earth can you lose weight if your knee hurts every time you do something? If you haven't checked out that video, make sure you go and look at that specific answer that I have there. However, losing weight is not going to just make your knee feel better. You might get some, but there are other things that you can do first to help yourself that doesn't involve a massive weight loss. So know that that's not always the answer. That's the answer you're given when someone doesn't know anything else about the joint and the muscles and the symmetry and how it works. Not all physicians and not all doctors are given detailed education on some of the orthopedics, and they're not using it with the functional body day in, day out. They might look at x-rays, they might look at MRIs, they might look at you in a surgery, but they're not looking at you moving. Why are doctors and other people giving advice on how your knee functions if they never ever watch you move? That's where someone with my specialty comes in. That's where we are designed to help you and to get that effect of knowing how your body is. You know your body best, and you know your body more than anyone else, and you have to give yourself credit for that. So if you want to lose a little weight, sure, it can only help with your general health, of course. You know that. Everyone knows that. However, there are other things you can do first to help out your knee. So know that that's not just the answer. It's kind of the answer when they don't know the answer, you know? Hope this video helped. check out the series on knee videos and get yourself the answers you're looking for and get yourself a little bit more help. If you enjoyed this, hit subscribe, let me know, tell me in the comments what you're dealing with, and maybe I can make a video specifically for you, as I want to help as many people as humanly possible. Have a great day. Bye, everyone.